Thank you, Maggie. Okay, so the next person up is David Portesi. He's going to be talking about a health services needs assessment of gay and bisexual men living in the Fraser Health region. So a little bit about David. He served as a director of public health at Fraser Health Authority from 2007 to 2013. He also holds a Master of Public Health degree with expertise in epidemiology and biostatistics. My God. All right, begin.
My mother still isn't happy that unless I have MD after my name, I have a feeling Christmas isn't going to be as fun as usual. I'm timing myself because I tend to talk too much. So we had an interesting start to the day where folks were asking what countries were you from? And so I'm going to ask you the exact same question, except I'm going to say, how many people in this room live in Surrey or east of Surrey?
I live in Calgary.
That's east of Surrey. I don't know if it gets to my demographic, but
I live in Calgary too.
You live in Calgary too. So it's telling and interesting that in this room, in a Gay Men's Health Summit, that I'm guessing that most of us, except for me, I live in the heteronormative oasis of Langley, British Columbia, that most of us live either out of province or live probably in the downtown or at least the close-in Metro Vancouver area. And that's been a problem for us as we look at how to serve gay men. We've heard, from Dr. Flower's presentation this morning, we learned that clinical services that are targeted towards gay men are important and often vital connections to the community. And really, up until this past spring and summer, we didn't have those clinical services in Fraser Health other than our excellent public health nursing outreach team who made particular efforts to outreach to gay men, but often had to do it through word of mouth and by making connections with individuals in the community and not really having a destination for gay men's health. And so the background for this, and you've probably seen a lot of this already, is what does HIV, particularly in BC, look like? And we've seen a decrease in nearly all other exposure categories, except recently, since 2003, in MSM. We've seen a bit of a decrease, but it's disproportionately smaller than that seen in other categories, including heterosexuals, intravenous drug users. And in Fraser Health, but the average number between 2003 through 2005, and then the same number for 10 through 12, it's 77% down among intravenous drug users and 31% down among men who have sex with men. So you can see we're seeing that real health disparity with gay men out in the valley. And I have to say, as a gay man myself, and having been responsible for HIV services for about 6 years in Fraser Health, most of our energy was spent on stuff that Vancouver did a few years earlier. So we were focused more on harm reduction and getting needles out to intravenous drug users. So while we're very happy about that 77% down, I do feel that there was work that was needed for the gay community. And certainly we also see that with syphilis. In BC, it's up 206%. And this is like having a really bad seat at a movie theater. So, and in Fraser Health, it's up 320%. Now, granted, magnitude-wise, we're talking about an increase of 15 cases of syphilis among MSM to 48. But if that's the tip of the iceberg, if we have those who are undiagnosed, if we have those that are being tested in the city but don't report a Fraser Health address, our numbers will be skewed. And then we also heard this morning that in addition to the usual suspects of barebacking, not being able to talk to your partner about sex, the typical public health interventions that we look at, we also know from man count data and the Sex Now surveys, but also a survey that was done in 2009, the Men's Sexual Health Survey that was commissioned for the Pacific Community Resources Society, that substance use plays a role. Geographic and sociological isolation plays a role. Homophobia and stigma plays a role, and poor access to care. So facing this context, HIM, the Health Initiative for Men, the organization that I'm representing today, and Fraser Health Authority partnered to look at a holistic model on how to meet a lot of the goals set forth in the ministry's Hope to Health charter. So wanting a 50% increase in HIV testing, wanting an increase in the proportion of HIV cases tested, diagnosed earlier, and elimination of HIV infections, and then appropriate treating of HIV positive individuals, in addition to combating syphilis, and primarily addressing a wider variety of health determinants and disproportionately experienced conditions in the gay male community than have traditionally been addressed by STI-only focused services. So wanting to break out of the box of STI only or HIV only. And to be honest, making some lemonade out of lemons with getting STOP HIV dollars a little bit later in the game than many of our partners, and wanting to go beyond, again, just the HIV or STI box there. So the method that we used to do this health assessment and to find out some more information about those gay men and bi men that were living in the Valley, and I have a little bit of angst about using gay and bi men. We started with MSM, gay and bi men, and we settled on gay and bi men, but know that whatever term you're comfortable using for yourself is fine with me, and no one term is perfect. But we did a two-pronged attack. You know, we did an online survey that was also administered in our clinics. So this was a survey that we developed based on many of the questions that are used in Sex Now, questions that were used in the Gay Men's Health Survey done by PCRS, and then some new ones that we came up with to specifically meet our needs. And so that was administered between March and May of this year. And then we also held, to get at that offline or not online piece, we held 3 community consultation events, one in New Westminster, one in Surrey, and one in Abbotsford. Now, all of this research was purposeful and non-probability. So I'm going to talk about statistics and all that, but just remember in the back of your head, this was really a convenient sample, folks responding online and in person to these groups. And so extrapolating this to every community, every gay man in Fraser Health wouldn't be appropriate, but it's a start. So some of the selected results, I really should turn my pages as I go through. Some of the selected results that we saw, we had from the community consultation events. So these are those 3 events that we had. 17 total participants, and I need to be completely honest here. In Abbotsford, we had about myself as a facilitator, I had 2 folks from HIM helping me, and we had 2 people show up. And so that's a lesson learned, and we'll talk about that towards the end, but outreaching in an offline way to more rural communities is difficult, and I think it's something we're struggling with, as I'm sure many other organizations are. But the key areas that came up around what should our services, what should gay-specific services look like, specifically clinical services. They said that these services must be discreet, located in lower traffic areas, subdued signage, private waiting areas, things we would expect. But also multi-service approach. It was okay for these clinics to be located near other services. They did not need to be in back alleys. They did not need to be hidden away somewhere, but they needed to be high-quality medical services that could be accessed as you would any other medical clinic. And then the other piece that was strong, and I can't state this enough, that they needed to see was, and we saw this in the online results as well, is that there had to be a social community building component. Gay men in the Valley are hungry to make social connections with each other in meaningful ways that get beyond just walking into a clinic. And HIM has a really great track record with doing these types of events downtown, but we start to see it more, for example, in Surrey, they just had a yoga group. So again, pulling men together to form more of a community. And then another surprise that we found in the discussion group were a real need for access to gay-friendly primary care. Gay men in the Valley, and again, about half of them said they would or may be comfortable talking to their doctor, half wouldn't, roughly, about gay sex issues. There is a desperate need for primary care providers, and this is only magnified the more east you go, the more rural you go. Looking at our online survey, we did have a relatively geographic, and despite all my comments that it's not a statistical sample, we did have a relatively good geographic representation. These numbers here reflect roughly what we'd expect to see for the population in Fraser Health. So we felt good about that. From a diversity perspective, it was, to be completely honest, the majority of our online sample and our in-clinic sample, that about 10% of our surveys came from our clinic-based settings. Were actually filled out in person and then entered in online. And then the remainder were all done online through fluid surveys. About 66% were Caucasian or white, 16% Asian. Interestingly, 3% Aboriginal First Nations or Métis. This, in my book, was a win because we're approaching a similar prevalence percentage in Fraser Health. Still not great, but the fact that they were even there was a real win for us. So again, fairly diverse, but that caution is there not to extrapolate this data per se to every single community in Fraser Health. Age, 62% under 40. As far as sexual identification, nearly 70% use the term gay to describe themselves, 15% bi, 3% queer, and then 1% for a multiple of other things, as far as homosexual or didn't use a word, things like that. And then, interestingly, to get to that social isolation piece, time spent with other gay and bi men, 26% spend most or all of their free time with other gay bi men, 57% some. Alarming to me, 17% of our sample population said spend no or almost no time. And this is not what you'd expect that, oh, all 17% were in Fraser East, all were out in Abbotsford. This was pretty consistent across all three regions of Fraser Health. So I'm going to focus very quickly on just 4 key areas, some regional differences. These are our designations, Fraser North, South, and East, our conglomerations for statistical purposes that Fraser Health also uses. So basically Abbotsford, Mission, and East is Fraser East. Surrey and South is Fraser South, and then anything north of the river, including Maple Ridge, is Fraser North. So the highest percentage, so the similarities were the most striking things. Most of the questions that we asked, which were around what would you like to see in a clinic, what are important health issues to you, the answers were pretty similar across the whole region, with some notable differences. Demographically, we did see more respondents under the age of 40 in Fraser East. Lowest overall percentage of non-white individuals, again in Fraser East. This doesn't mean that that's what the population looks like. What it means is, who are we missing? Who are we missing with this survey? And so this is, again, a caution for future research. And then recent HIV and STI testing, it's somewhat alarming. So in Fraser East, 44% of our respondents said that they've never had an HIV test or had an HIV test over a year ago, compared to 20% in the South and 11% in the North. And so while we can come up with a lot of theories, likely some form of access to services is playing a role in there. Looking at desired services, just to give you a taste, the top across the board in all 3 regions, the top desire was to get help being more active and getting in shape. Of course, there were the issues on there around getting tested and wanting to talk about safe sex practices, both getting an HIV and a syphilis test, but also wanting to learn how to eat healthier, and wanting to talk about to guys about getting the type of sex that they wanted. Now, to be fair, this was done in a Likert style question, so we had a wide variety of health-seeking statements, and so we did force a choice a bit, but it's interesting that these are the ones that came to the top. As far as desired clinical characteristics, what you'd expect. There was nothing really out of the ordinary. Folks wanted evening hours, wanted weekend hours. It was better if the clinic is close to where I live. And this comes out of the narrative, particularly in First Nations communities, of men who do not want to be tested on reservation. And I think this is a story that we have that we need to check out. It might still be true, but this is from earlier in the day. So this idea of, I don't want to get tested in my own town. I don't mind going down to Vancouver. Well, of course they didn't mind historically going down to Vancouver. That's all there was in many respects, as far as gay-centric type of clinical services. So it was interesting to see that they do want it close to where they live. They don't mind using signs and posters. The clinic should be located with other businesses and services and public transportation when it's working. Yeah. As far as the methods or sources of information, and I realize I'm throwing a lot at you very quickly, for outreach purposes, internet was definitely the top source of information. More frighteningly, Google was the top source. So ask yourselves about your organization, where do you come up in a Google search? Are you 10th on the list, below some pay sites? Are you coming up first? That type of traffic question is really important this day and age. Family doctor was also high, friends and peers, community organizations, nursing, you know, a public health nurse, and then other, 2%. As far as motivations for testing, part of a regular checkup, I think this really gets back to the tack that STOP HIV is taking, is making it part of routine medical care. They're on the right track. Recent risky sexual activity, or as nearly everyone called it, the oh shit moment. Oh shit, I partied a little too hard this weekend and I really need to go get a test. And then of course, there's other motivating reasons on there that we're pretty familiar with. Access to primary care, again, just a bit alarming that around, just under 50% would not or have not told their doctor about their sexuality, or they're uncertain if put in that situation. So again, this is reproduced from particularly the Fraser Health, the Valley survey that was done back in 2009, the Gay Men's Sexual Health Survey. So some key recommendations, and I won't go through them exactly with you, but I will touch on a few. It's lovely. It's weird to read up there and incredibly small on my handout. Start by mirroring the HIM services that are in Vancouver. So this was important because a lot of the gay guys, about 25%, particularly I think it's at the Davie Street Clinic, was it Sam? 25% are from the Valley, or clients are from the Valley. So they were already saying, just come out to the Valley. Bring what you have here out to the Valley, and that would be a success. Again, using that whole health approach, especially around developing community, social opportunities for men to connect, to reduce social isolation. Offer cultural competency to training to medical care providers, nurses, doctors, those in other medical fields, so that gay men know that they can be cared for in a culturally appropriate, meaningful way. And then have a referral network so gay men know who those physicians are for those who need a gay-friendly physician. For places like Fraser East, because we know there'll be a delay to get some services out there because we're starting with New West and Surrey, think about partnering with existing medical clinics. Don't reinvent the wheel, build off what we already have out there. We have physicians out there that are specifically on board to see clients, for example, living with HIV. So making sure we're capitalizing on that opportunity. Our outreach, many people know him for their provocative advertising campaigns, and those are incredibly successful. And we heard positive feedback around those sexy pictures, even out in the Valley, as you would expect. But there was this idea of, okay, in addition to that, to augment that, have some lower key outreach materials for the closeted gay or bi guy that really doesn't want his mother, girlfriend, wife to find a condom pack in his pocket that has 2 gay men fucking on it. So having that lower key, that sort of less sexualized or differently sexualized imagery was important. And then finally, incorporate HIV and STI testing messages that address being tested as part of a regular checkup, testing due to recent risky sexual activity, and/or testing when entering a new relationship. And these, again, came up from the suggestions that we had from our groups. So lessons learned, surprise, surprise, outreach in rural areas is hard and we still don't have it right. So there will be ongoing effort, so stay tuned. HIM does a great job at doing clinic surveys of the people that actually use their services, so we will get some more information there. And then the future's bright. Very quickly, we hope HIM opened the HIM clinic in New Westminster, and just recently opened up the second site in Surrey, and we're getting gangbuster numbers already, and just started a yoga group in Surrey that met the other night. So again, this sort of basic, pragmatic type of research is really helping us tailor our services as we move into the Valley and serve those underserved gay men that we know are there, because I live there. Thank you.